Thank you for joining us for tonight's educational webinar on minimally invasive spine surgery. Tonight's speaker is Dr. Ranjit Ganguly, OrthoNeuro Neurosurgeon. Dr. Ganguly is a fellowship-trained neurosurgeon specializing in minimally invasive complex spine surgery and brain-related disorders. Dr. Ganguly will answer questions following his presentation. Please type the questions into the Q&A box at the bottom of your screen. Dr. Ganguly?
Recording in progress.
All right, thank you everybody for joining. Let me share my screen here. All right, are you seeing my screen?
Yes.
Okay, very good. All right, well, thank you everybody for joining. Tonight I'm very excited to talk about a subject that's very near and dear to my heart, and something that is really a very exciting new frontier in patients with spinal conditions and in spine surgery as a whole. So my talk today is titled Empowering Health: A Patient's Guide to Minimally Invasive Spine Surgery. So first, want to give you guys a little bit of a background. This is going to be just a very brief kind of bird's eye view of spine surgery. What is minimally invasive spine surgery? What is traditional spine surgery? What are sort of the benefits of minimally invasive approach to the traditional open approach? And what are some conditions that we can treat with the minimally invasive approach? So first, a little bit of backstory. Neck and back pain, along with radicular type pain or nerve pain, is actually one of the most common reasons for people across the board to end up going to see their primary care doctor. Usually this pain is worked up from their primary care doctors with a series of x-rays or CT scans or MRI scans. And then if they show anything that's concerning, the primary care doctor may then refer them to a spinal specialist. So some of the conditions that patients get referred to spine specialists for are things like disc herniations or slip discs. I have some images here showing some of these pathologies. So here in this first image, you can see this. The white are the bones, the vertebrae of the spine. These blue shock absorbers or cushions are the discs, and then here there's evidence, highlighted in red. This is a disc that's herniated. The problem with herniated discs are that each of these discs lie very close to the nerves that come out at each level of the spine. So if people have very significant disc bulges or disc herniations, that can press on the nerve, causing sharp stabbing, severe pain that typically travels from the back down the leg. This is commonly referred to as a sciatica type pain. Other very common spine conditions are spinal stenosis. So in this second image over here, you can see this is the vertebra again. This is sort of an axial view, or kind of a cross-sectional view of the body. In the center of that vertebra, you can see this is the spinal cord, the spinal canal. When you have spinal stenosis, this is usually can be caused by a number of different things. One is a herniated disc. One is arthritis or wear and tear type changes, in which these joints start to get hypertrophied or they start to get enlarged. The ligaments can get thickened. All of these can contribute to narrowing of that spinal canal and causing spinal stenosis. Another common spine condition is scoliosis. You can see here in this picture, this patient has a curvature of his spine. This is scoliosis, basically that curvature, abnormal curvature, as well as a kyphosis, which is, you can see his posture is very much leaning forward because of that bend in the spine. And a number of other conditions, degenerative disc disease, which is basically, oftentimes can lead to disc herniations or disc bulges. And then lastly, fractures. So many times people who have motor vehicle accidents or falls, especially as we age, people have a tendency to become to have osteopenia or osteoporosis. That can cause people very prone to developing these fractures after even mild falls. And then this last image just is an image showing, a gentleman with back pain and some of the various things. This is actually showing degenerative disc disease, where this first one is a normal disc. You can see this one is thinner. And then here, these discs are basically flattened out, and there are a number of bone spurs throughout the various levels of the spine. So always with spine surgery, there are two main principles of spine surgery. The first principle is a decompression. So anytime there's a pinched nerve that's causing very intense symptoms, usually the first methodology for treatment is to undergo physical therapy, to undergo medications to help calm the nerve pain, to help calm those nerves down. If despite these medical treatments, even sometimes we would refer people to some of our colleagues in pain management or pain medicine for an injection to help calm the nerve down, to help reduce that nerve pain. If people still have symptoms despite all of these conservative things, the first thing we think about is a decompression type surgery. Now, the goal of a decompression obviously is if there is a nerve that's causing very significant back or leg pain, we would then decompress or free up whatever is pressing on that nerve. So whether it be ligament, whether it be some bone, whether it be a disc herniation, whatever is that particular patient's issue that's causing that nerve to be compressed, we would go in and decompress the nerve. These are some various conditions that can cause compression on the nerves, in which a decompression type surgery may be a good option. Additionally, the second type of a realm of spine surgery is a fusion type surgery. Now, fusion alone is rarely done. However, it is done in certain circumstances of trauma, for fractures, various types of fractures. In those cases, we would do fusion only surgery. But most commonly, we implement fusion when in combination with a decompression. So in general, we end up recommending a fusion type surgery for patients who have instability on their spine. So a lot of times these wear and tear, bone spurs, degenerative type changes are caused from instability of the spine over a long period of time. So in those certain circumstances, we can opt for a decompression to free up the nerve, and also a fusion surgery to help then stabilize the spine. Now, sometimes people who have instability of their spine, they can present with things like axial back pain or low back pain that gets worse when they load the spine or stand upright, and may get better when they lay down and unload or deload the spine. Additionally, sometimes instability can be caused by a previous spine surgery, a previous fusion surgery. So sometimes people who have a previous fusion may then develop additional wear and tear on levels either above or below where they already have a fusion. So that sometimes can cause instability, and that may require a decompression and fusion type surgery. Additionally, spondylolisthesis, which is basically a fancy word for when one bone is slipping forward on another bone. So these two images here, you can see this is what's called spondylolisthesis, or basically, here you can see this bone is slipped forward compared to this bone. And so this patient required a fusion surgery because likely, he was having nerve compression because of that slip, as well as back pain and instability. So the surgery for that would be decompression to relieve the stenosis, to free up the nerve, and then also to fuse the spine, to stabilize the spine, and also reduce that slip. Lastly, the extent of decompression is sometimes a requirement for a fusion surgery. So, for example, if a patient has very severe stenosis at multiple areas across a nerve, that would require a vast segment of the nerve to be decompressed, then in order to decompress that nerve, we may have to remove a lot of bone, and that may create some instability in the spine. So if we have to remove a good amount of bone at that same time of surgery, we would know beforehand how much bone we would have to decompress or have to remove. And so then we would opt to also perform a fusion surgery at the same time of the initial surgery. So those are kind of the two main principles of general spine surgery. So on one side you have decompression, and on the other side you have a fusion, which is typically also so in general, for open spine surgery, we make a midline incision in the spine, in the back. We have to then dissect all of this subcutaneous tissue, the fat, and also all of these muscles. So this is the multifidus muscle and the paraspinal muscles, or basically all of those muscles that surround the spine have to be reflected, moved aside, and dissected in order to in order to even just access the spine. So to gain access to the spine, we have to do a good amount of dissection. And the issue with that is a lot of times with this dissection, we actually end up injuring a lot of the muscles of the lower back, particularly the multifidus and sometimes the paraspinal muscles. But, you know, historically, that was the only way to approach the spine. We have to gain access to the bones, to the ligaments, to the nerves, and that was really the only way in the past. Minimally invasive spine surgery is a new philosophy of spine surgery in which, you know, we are able to access those same parts of the spine. However, we're able to do that without making those very large midline incisions in the back. We're able to access the spine without having to retract all of those muscles, without having to damage a lot of the subcutaneous tissue and muscles that surround and that help to stabilize the spine. So this image is just a picture, a diagram on the left here showing one such methodology to perform minimally invasive spine surgery in which the surgeon is working through the tube. So a lot of times we're able to, with X-ray guidance, dock a tube right on the exact part of the bone in which we're needing to perform the surgery. We dilate up the size of those tubes, and we're able to perform the entire operation through a tube that's about this big. So we're able to preserve a lot of the paraspinal muscles, we're able to preserve a lot of the ligaments, and we're able to really leave only a very minimal footprint on the spine. This is a diagram just showing some of the muscles in the spine that help to stabilize the spine. So number 2 here is the multifidus muscle. Number 3 here is the erector spinae. These are all the paraspinal muscles, or basically the muscles that surround the spine that are on either side of the spine. When we do traditional open spine surgery, both we have to, for muscle number 2 and number 3, we have to dissect around those muscles, push those muscles aside, reflect those muscles. And oftentimes these muscles undergo a lot of damage because of just the need to access the bones of the spine. In minimally invasive spine surgery, oftentimes we're able to actually split between these two muscles to put the tube down and do our entire operation between these two muscles, which again offers a very leaves a very minimal footprint on the spine, minimal damage to these muscles, and minimal damage to the surrounding soft tissues. So I like to say minimally invasive spine surgery is a muscle sparing approach to conducting spine surgery. This is one such example again. So on the left image here is a diagram showing this is a traditional open spine surgery to perform a decompression and fusion type of surgery in which all of the muscles and soft tissues of the spine are reflected, moved aside so that the surgeon can gain access to the spine to conduct a surgery. For minimally invasive, you can see all of this soft tissue is still intact. The surgeon has docked the tube down. There would also be another incision on this side where it looks like he's placed the screws from a separate incision. But then all of the decompression and interbody type work is done through this tube. This is just an example of some of the skin incisions for side-by-side side-by-side comparison for open spine surgery versus minimally invasive spine surgery. This again, is just a representative image, not necessarily 100% accurate, but just to give you an idea. So traditional open spine surgery, because we're having to gain access and reflect all of the soft tissue and muscle, we would require much larger incisions in order to access the spine. For minimally invasive spine surgery, oftentimes you may have 2 incisions, one on either side of the spine, but they're oftentimes much smaller. And again, it's not necessarily the size of the incision that's important. It's really a lot of the preservation of underlying soft tissue and muscle that is able to be preserved in a minimally invasive approach. So some of the benefits of minimally invasive spine surgery, as I've talked about already, preservation of those paraspinal muscles, the muscles surrounding the spine, that is really the key and really provides so much benefit for patients moving forward after spine surgery. Additionally, minimally invasive approaches can oftentimes would have less blood loss. Typically, we see anywhere range of 50 cc's or, much significant a much less amount of blood loss in minimally invasive approaches than the traditional type of approaches, which may have 300, 200, 300, 400 cc's of blood loss to carry out any given operation. Additionally, patients who undergo minimally invasive spine surgery may have a reduced amount of need for narcotics. They may be able to spend less time on narcotics. And again, that's because there's a very minimal footprint on the spine, minimal amount of dissection or disruption to the natural normal tissue of the spine. This also leads to faster recovery times and also shorter hospital stays. So patients who undergo this type of operation can typically expect, to stay in the hospital 1 day after surgery, or even sometimes they're able to go home the same day after having an operation. So who is a candidate for this type of an approach? In general, patients who may be candidates for traditional spine surgeries may also be candidates for minimally invasive type of surgeries. So the benefit of that is it can be applied and it can be offered to a wide variety of patients. Additionally, patients who may be slightly overweight, they may actually not be candidates for traditional open spine surgery because the amount of dissection, the amount of bony work that needs to be done, the amount of exposure that needs to be done may be quite significant, and that patient may not tolerate such a big operation. Again, a minimally invasive approach, we're conducting the entire operation through a tube, so that may offer those patients an alternative, or even some patients who may not be candidates for traditional approach may be candidate for a minimally invasive approach. Additionally, patients who are elderly or who have multiple medical comorbidities or medically complex patients who may not be able to undergo a big operation may be able to undergo a minimally invasive type operation. Who may not be a good candidate for minimally invasive approach? So typically patients who have revision spine surgery, they've had previous spine surgeries, previous fusion type surgeries, those patients who have issues at levels above or below previous surgeries, they may not be a good candidate for minimally invasive approach. Every surgeon is a little bit different and has a little bit different algorithm for who they would include, who they would offer minimally invasive approaches to. But in general, I would say if you have previous fusion, previous spine surgery, minimally invasive may not be a good option because oftentimes the previous hardware may need to be removed and re-implanted. We may need to explore the fusion that's already been there to see, is that area stable? And so those kind of operations can be very, very difficult, almost impossible through just doing it through a tube. Additionally, patients who are morbidly obese. So patients who have BMI, 45, 50, those patients may not be good candidates for minimally invasive approaches just because when we're operating through a tube, there's a limit to how far those tubes can reach. And so oftentimes patients who are very morbidly obese, the tubes may not even be able to reach down to the spine. And so obviously we couldn't wouldn't be able to perform a surgery in that circumstance. Sometimes patients who are undergoing multiple levels of spine surgery or spine fusions may not be the best candidate for a minimally invasive approach, because each time we have to put a screw, or each time we have to do a decompression, we're having to take the tube out, put it back in, make sure it's docked appropriately. So all of this can add significant time. So if a patient has multiple levels that may need to be done, it may be faster for the operation, for that surgeon to do it in a traditional open approach than in a minimally invasive approach. And lastly, I would say scoliosis type correction. Anytime we're correcting a spinal deformity or an abnormal curvature of the spine, those can be cases which can be incredibly challenging. Not that they're impossible through a minimally invasive approach, but oftentimes the open approach can be favorable to help correct scoliosis. The last thing I want to do is I was able to recently talk on the NBC News for a short segment to talk about minimally invasive spine surgery, and I would like to play that video for you guys here. So let me just click this link, and then hopefully it should take us.
I even started to notice some of the hair growing back at the end of the first bottle.
This has literally changed my life.
It comes in a little dropper. You just
All right, few surgeries strike kind of anxiety in the hearts of patients, quite like hearing spinal surgery, right? Despite their level of pain or injury, most are hesitant to go to such an extreme, which is why I'm fascinated to hear what my next guest has to say about minimally invasive spinal surgery. So here to explain, we have Dr. Ranjit Ganguly with OrthoNeuro, the sponsor of this segment. So good to have you on.
Thank you, Robin. Happy to be here.
All right, so when we talk minimally invasive, that is not something that you automatically think of when you think of spinal surgery, right?
Correct, yeah. Yeah, traditional spine surgery, you know, if you imagine, if you feel your back, you can feel one little tip of bone, but then your spine is basically, the spine bone is basically encompassed by a big block of muscle. So typical open spine surgeries, in order to access the spine, you have to open the skin, really dissect and free up a lot of that muscle from the spine just in order to access the spine. Minimally invasive spine surgery allows us the ability to access the spine without disruption of the muscle.
Okay, and that's probably huge when it comes to recovery, when it comes to the actual procedure too, right?
Absolutely. So the recovery time for minimally invasive spine surgery is much quicker. Obviously, because of that preservation of the muscle, of the soft tissue, there's much less postoperative pain. Some of these procedures can even be done in an outpatient setting, meaning you're able to have your surgery and go home walking, feeling much better, pain relief the same day of surgery.
Wow.
So it's really been a shift in the mindset in spine surgery, and of spine surgeons being able to offer this to patients.
So what types of injury, what type of ailments would fall under this? Because we know a lot of people struggle with different varieties of back pain, right?
Correct. So minimally invasive techniques can be employed, can be utilized to treat a variety of spinal conditions. These include stenosis, or pinching of the nerves, instability, as well as things even such as spine tumors or infections of the spine. So really the ability for minimally invasive surgery is pretty, it's a pretty vast network of things that we can offer in terms of conditions to be able to treat it in a minimally invasive fashion.
Okay, so kind of on that same end, but are there certain patients who respond better with that? Are there certain patients who are going to say, you know, I didn't want to be under the spinal surgery with the drastic recovery. Now this is something I can do.
Right. So historically, patients who have larger body habitus, or who struggle with obesity, they've been unable to undergo spine surgery. Sometimes in some patients, minimally invasive approach can be used to allow them still the opportunity to get some relief. Additionally, patients who are elderly or who have more severe medical conditions, they may be a candidate for minimally invasive surgeries because the stress and strain on the body and the recovery period is less. So It's not a cookie cutter approach, and I always say every patient is different.
Right.
Every patient has unique characteristics and medical history that need to be explored and need to be uncovered before determining who is going to be a candidate for this, but it definitely provides us another opportunity or adds some thing in our armamentarium to be able to offer patients who have spinal conditions the ability to get some relief.
And I imagine you telling a patient, too, that this is an option is probably a huge relief when they hear, you know, spinal surgery, right? They think of that drastic measure that you talked about and saying, we don't have to interrupt your life.
Correct, yeah. So a lot of patients, you know, they have a big fear of spine surgery, and you know, they may have had some poor stories that they've heard, but minimally invasive approach obviously is just that, and the goal of that is to accomplish the same goals of an open traditional approach, however minimizing the recovery time, minimizing the tissue disruption, and getting people back to having a high quality of life faster.
And that's important to note. You're saying it's not as if we're only doing half the work. That is why, you know, you're getting a minimally invasive procedure. We are doing the same thing, just very less intensely.
Correct.
Right,
So
to the body.
Absolutely. In minimally invasive approach, we have to be very deliberate and very purposeful because we're making very small incisions. We're making basically a minimal footprint on the spine. So we still accomplish all the goals of surgery, whether it be to decompress the nerve that's pinched, whether it be to, you know, put the rods and screws in, hardware to stabilize the spine. All of the goals of surgery are the same, but just the amount of tissue disruption is much reduced in order to preserve the muscle and the soft tissues.
Yeah, the integrity of the spine. Okay, doctor, I want to let people know then where they can find you, which OrthoNeuro offices you operate at.
Absolutely. So I'm based out of New Albany locations as well as Pickerington and Grove City.
Okay, all right, and you can always go to the website, the phone over there on screen as well to find a location near you. Doctor, thank you for being here.
All right, thank you so much. Appreciate it.
It's a shame so many women struggle to lose weight. When this special coffee...
All right, so that's all I have for an overview of minimally invasive spine surgery. I want to again thank you guys for joining, and I hope this was informative. I'd be happy to take any questions now that you might have.
So we have a few questions. The first
Okay.
question is, can you do fusion outpatient?
That's a great question. So there are some circumstances where you can do fusion outpatient. I'm assuming the question is about lumbar fusion. Sometimes there are the ability to do a minimally invasive fusion as an outpatient. Again, it would have to be a very healthy patient in which we would, you know, in which we would not expect any sort of complications or not expect them to need any sort of inpatient stay for pain control and those sort of things. It is an option, yes, but again, it would have to be a very carefully selected patient.
How does new technology affect spine surgery?
Yeah, great. So new technology has really started to open up the field of minimally invasive spine surgery. And, you know, now we're able to, you know, perform these operations. Before, we would have to visualize the entire spine in order to put in the screws, in order to do the decompression, in order to put the cages in. Now we're able to utilize technology such as intraoperative CT scans, which is basically, you know, the patient has a CT scan that's done during surgery, and then we use that CT scan to register our equipment, to register our drills, to register our screws, and we're able to use that CT scan almost like a GPS navigation type system within that patient's body. So the patient would come in, they would have, you know, the CT scan done, the incisions would be made, and then we are able to do the entire surgery looking at a monitor instead of having to open up the entire spine. So like that's just one example. There are many other types of technology that are coming in and that are being employed. There's also robotic spine surgery, which is something on the forefront as well. So a lot of new technologies such as that come in to allow us to be able to perform surgeries in a minimally invasive way.
What is the difference between spondylolisthesis and spondylolysis?
So spondylolisthesis is when you have a slip. So when one vertebrae is slipped usually it's forward on the other. So that's called a spondylolisthesis. Spondylolysis is each part of the bone we have what's called a pars, which is basically the part that for any given bone that is sort of the middle point between the joint above and the joint below. So a spondylolysis is basically people can get a fracture at that area of the pars in the bone. So that can oftentimes be due to a lot of mechanical type stresses on the spine where they have, and that can lead to a fracture in that particular area. So that's typically called a spondylolysis or that fracture.
Is everyone a candidate for minimally invasive spine surgery?
I wouldn't say everyone is a candidate. Again, there are some conditions or some patients who a minimally invasive approach is not the easiest way to perform surgery, and typically you want the operation to be an easy operation to be performed. You don't want surgery to be unnecessarily difficult. So like I had mentioned, in patients who have had previous fusion type surgeries, patients who have very bad scoliosis that needs to be correcting, a lot of these can be done with minimally invasive approaches, but the minimally invasive approach may make it very, very difficult and may actually be much more taxing type of a surgery to perform in that way than the traditional approach. So not everybody is a candidate for this. For some patients still, and even a good amount of patients still, the traditional approach for spine surgery is the best approach. Again, it's very nuanced and it's very difficult to pinpoint. It's not a black and white type of categorization. And also every surgeon has different levels of comfort with different procedures in which they may offer MIS approach versus an open approach.
What is the recovery time for minimally invasive surgery?
So typically, again, it would have to depend on the exact surgery that's being done. But typically, the recovery time is about a day in the hospital, and that day is mostly just spent for that patient to allow themselves time to get acclimated for after they've had the surgery, to see if they have any postoperative pain needs, as well as working with physical therapy and seeing how they are, making sure they're stable on their feet. So typically, the recovery time is about a day in the hospital, and then usually about 2 weeks with minimal lifting, bending, or twisting. And then depending on what kind of surgery needs to be done, the restrictions may be anywhere from 2 weeks to 6 weeks, and subsequently after that, peeling back some of the restrictions after that time period.
How long does it take to get an appointment for you to evaluate my back at OrthoNeuro?
So, generally, I'd be happy to see anyone and everyone. Typically, the wait is not that long. Usually we're able to accommodate patients on a fairly rapid basis. So, usually within 1 to 2 to 3 weeks, we're able to get a patient scheduled if they're interested to come and see me. It also depends on which locations that you might be interested to come to. I have clinics in 3 different locations: New Albany, Pickerington, and Grove City. So depending on times, location, all of that stuff, may impact things, but typically generally anywhere within a couple of weeks.
Great. That was our last question. Does anyone have any additional questions? Thank you very much, Dr. Ganguly.
All right. Thank you for having me. And I hope this was informative. And, for anyone, feel free to reach out, or I'd be happy to see you in clinic if you had any questions. So appreciate it. Thank you.
Thank you for participating in tonight's webinar. This was our final webinar for 2023. If you're interested in viewing previous webinars as well as this webinar, please visit OrthoNeuro's YouTube page. Enjoy the rest of your evening, and good night.